Good morning, good afternoon, and thank you for joining UMTRC webinar, virtual hours on the topic of virtual etiquette. Today we have a presenter, Becky Sanders, with the UMTRC, and we really appreciate you joining us today, Becky. Becky, we have you on mute. Thank you.
Sorry about that. Hi, my name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. Our topic today is video etiquette. With COVID-19 and the growth in telehealth and all of the waivers that are reducing barriers for delivery of telehealth services, this is especially important, and all of us are spending many hours on virtual video calls these days instead of taking meetings in person. So it's just good for all of us to think about what our backgrounds look like, what our lighting is like, those types of things, and we're going to talk about all of them today. If you have questions, please put them in the Q&A box, and I'll stop every once in a while for questions. Use the chat only if you have technical issues for today. So when we talk about telemedicine room design, really a lot of times we would talk, pre-COVID, we would talk about just a clinical patient room in a primary care office or any other type of doctor's office where the patient would normally be, and have a computer then to have a meeting with a specialist at a distant location. So how much space do you need? Really, you just need to be able to enough space in a clinical office where the patient's going to be to access whatever type of equipment that you're going to use for that visit. It could be a laptop like we see here with an external webcam, or if it's a newer laptop, it's probably got a built-in webcam. Those types of things, adequate lighting, adequate microphones and speakers to be able to hear the audio well. But now with COVID-19, a lot of patients are being seen from home. So there's different things, you know, when you're seeing a patient at home, you always want to be aware of privacy. Is the patient in a safe place? Are they able to talk freely? And as a provider, you want to think about your webside manner instead of bedside manner, and how you react and interact with that patient. So right now, I've got two screens on my computer here set up. And if I was looking here on this screen and looking at an electronic medical record on here, the patient thinks that I'm not paying attention. They don't see my face directly. So we want to make sure that there's a clean, clear path between my face as the provider and my webcam up there. So the way I've got things laid out on my screens today is I've got my presentation here and then my own self view right here underneath that camera. So I can see out of my peripheral vision my self view and make sure that I am connecting directly with you through the lens of my webcam. Another thing that we have talked about a lot, and Luke is going to do virtual office hours next week for consent and documentation. And what we'll find there is that consent needs to be obtained to see a patient in via telehealth or telemedicine, and also that that can be done verbally. You can read your patient consent form to the patient. They can tell you over the video that yes, they consent to being seen via telemedicine, and you need to keep a record of that on file. If your patient is able to, if you're able to email and the patient can sign it and scan it and fax it back or email it back to you, that works. If you need to mail it to the patient and then sign it, mail it back, that's fine, that works too. Or if you've got a patient portal and you can send that and the patient can sign it electronically and then it's in the patient portal and can be imported into the electronic medical record, that's fine too. And then as far as vital signs go, We know that you can't really do a physical exam via telemedicine, but what you can do is talk to your patient. And there are some new guidelines coming out about, watching the patient go from a sitting position to a standing position, and you can tell different things about muscle atrophy by that. As far as normal vital signs, most homes have have a scale. A lot of homes have thermometers. A lot of homes have blood pressure devices, and there's all kinds of consumer devices. If your consumer is willing to do that, they can go out and purchase or apps or get devices to record all of their own vitals, and then they can verbally give those to you, or sometimes in remote patient monitoring situations or chronic care situations, providers have given a device to patients to use to record their information, and then it's digitally transferred back to the office and to the patient record. So there's a lot of options for this. Then if you're doing, and we've done some webinars recently, and there's been a lot of talk about diabetes self-management training. So if you're doing a visit where you've got a classroom, or even, could be group therapy or group diabetes education, the presenter can deliver that remotely and then have a group there for class. So then again, your patient, where your patients are located is going to be different depending on how many are signed up for that particular session. Here it's important to think about the viewing and how the cameras are set up, so how the presenter can see the room layout. And for this you would want multiple cameras so that everyone could see what's going on, and the presenter could still engage with the student audience or the patient audience. So you might want to use whiteboards, just as if the presenter was there in person. They might want someone to help them to make notes on a whiteboard or an easel during the presentation. There might be different tools. If you're talking about nutrition or diabetes education, you might have plates for the patients that show the portion of carbs and portion of protein on a plate, or fake food to show, okay, this is a portion, what is an actual portion size. Or you can use things like your thumb or the palm of your hand, those types of things. And then you need to make sure that whatever screen that is in the patient area is big enough for them to see all around the room. So next, we're going to go through some videos, and this is all about eye contact, what junk is in your trunk, and lighting. So eye contact, I've talked about that already, about me as I'm presenting, trying to make sure that I have a clean and uncluttered view between me and my webcam so that you can see me and hear me. And we'll go through some other examples here as well. So let's see what we've got for you. So here's that clean and uncluttered view. This particular young person has a tablet in front of them, and they don't have anything between them and that tablet. So they've got that clean and uncluttered view. That's important for the patient as well as the provider. And then your camera positioning and placement. I've talked about what I've done here, but think about it as you're being photographed, because really you are. A live and interactive video, you're being showcased. It's not a still photograph, it's a video, but it's just as important. Oh, I'm sorry, there. Next, lighting. So you want diffuse lighting. I have a window over here. I do have my blinds closed, but it still does give a little bit of shadow here. I forgot to turn on, I have a craft light that I usually turn on. I forgot to turn that on before we started today, but that helps to light me from the front, to front light my face so that there's no shadow over here. And then it helps to even out skin tones and that kind of thing. Now here in this particular picture, she's really backlit. You can see the light shining on the post outside of, out behind her where she's at in that room with the big large windows. And then here it's the same person, but from a different angle, so that her backlighting isn't as bright and it's not washing her out. So you can see much better. Here, this physician has a good background. You can see all of his credentials, his me wall, as sometimes they're called. But he's got a lot of glare coming in from his windows. It would be a lot better if he closed his blinds there. And then distractions. Here, where I'm at in my home office, I've told everybody that's in the house that I'm going to be on a video, that I'm doing a recording. They are not to bother me. They're not to call me. They're not to knock on the door. They're not to let the dogs come up here. All of these things to minimize any distractions. So you don't want somebody coming into the scene when you're with a patient and trying to talk to you and hand you documents. That's a distraction, and it's rude to your patient. Also, if you're taking notes, so if you are leaning down taking notes, all that your patient sees is the top side of your head. So if I did, with my second monitor over here, have an electronic medical record open, I would say, that's great. I want to take a second and I want to check something in your chart. So I'm going to check your chart, and I'm over here and I'm doing my thing. Okay, great. Now I come back and I address my patient again, and we're off and running. So finally, what is in your background? What junk is in your trunk? So here we've got a couple of pictures. Kind of looks like a college student, a messy office, kind of weird stuff back in the background. Again, the lighting, those blinds, if he was on a video call, you'd really want those blinds to be closed. Here in the lower left corner of the slide, again, we've got a pretty messy office area, and you really want a clean look, a clean professional look behind you. As you can see behind me, I have a physical 8x8 banner behind me. It is made for photos at events, that type of thing. So you really need to think about minimizing any distractions in your background too. You don't want a plant coming out of the top of your head, or overhead lighting is really bad. It usually washes you out, especially if it's fluorescent lighting, and it could create a halo effect around your head. So here's another example. So you see you've got the wood, which is not really a bad background, because it's nice and flat and very, not symmetrical, but unassuming. There's not weird things that you could pick out of there. Now, if the background was all of these books, these random books and coffee supplies, that probably wouldn't be a good background. And having the plant right directly behind your head would not be a good background. But the actual color of the wall is really fairly good. So studies show that light blues and light grays are really good background colors for all skin tones. And here's some more examples of clean and uncluttered backgrounds. Again, you want that view between yourself and your camera to be clean, so that you can focus on the conversation between you and the provider. Let's talk a little bit about external noises. There's all kinds of noises that can also be distractions in a telemedicine visit, either on the patient side or on the provider side. If you are right near the elevator and it's always dinging, that could be a distraction. If you're right near a staircase where people are constantly going up and down the stairs, pounding on the stairs, or there's, the fire doors that close and bang if you're not real careful, or even if you're in a downtown or a metropolitan area with lots of traffic, that could create lots of distractions. So you really want to try and find a room, both on the patient and the provider side, that's away from noisy HVACs, away from traffic. In the emergency department, this could be an issue if there's always sirens going from ambulances arriving at the emergency room. So you need to think a little bit about the placement of the room where you're going to be during the visit. And then acoustics. A lot of clinical spaces, or most clinical spaces, are designed with tile floors and high ceilings. Sometimes there's sound dampening acoustic tiles in the ceiling. You can hang drapery to reduce echo, drapery around the windows. Then there's actually sound dampening paint that you can purchase that will help to reduce echoes in a room. If you're familiar with being in choir or band or orchestra, there are also sound panels that you can put on walls to absorb echoes and sound. All right, that is really the end of today's presentation. I want to go ahead and open it up right now for questions, and remind you that you can contact us through our website and join our mailing list, and can also touch base with us either on Facebook or LinkedIn. And we've got a bunch of different resources we've put up on the website all around COVID-19, and Autumn manages those for us. We've got several webinar recordings, toolkits, other resources. And when you're reaching out to the UMTRC, you're probably going to be speaking with one of the three of us, either Autumn, Luke, or myself. And I will I'll warn you right now, I did leave the phone numbers on the slide today, but we are experiencing very heavy call volume, and honestly, email is the best way to reach out to us. So what questions do you have?
Well, Becky, I don't see anything in the Q&A, but thank you again so much for hosting this webinar. And we enjoy everyone for coming and viewing. And just an extra reminder again, this will be posted on the UMTRC's website. Just go right into umtrc.org and it will direct you to the archived webinars. Thank you again.
Thank you. Have a good day, everyone.